Medicaid is a cornerstone of the American healthcare system, providing health coverage to millions. It operates as a joint partnership between the federal and state governments. Think of it as a critical safety net, ensuring access to doctors, hospitals, and treatments. Currently, Medicaid provides essential health coverage to over 85 million Americans. This means approximately 1 out of every 4 people in this country relies on this program. The individuals and families who depend on Medicaid come from all walks of life. They are our neighbors, our colleagues, and members of our communities. Understanding who Medicaid helps and its critical role is essential. The discussion around Medicaid funding has real-world, life and death consequences. A study from the National Bureau of Economic Research found Medicaid expansion under the Affordable Care Act was associated with a 21% reduction in mortality. This translated into an estimated 27,400 lives saved in states that expanded Medicaid. Another study in the New England Journal of Medicine focused on duals, individuals eligible for both Medicare and Medicaid. Losing Medicaid coverage can lead to losing the Medicare Part D low-income subsidy, crucial for affording prescription medications. The study linked the loss of this subsidy to a significant increase in mortality. These studies provide a data-driven warning about the human cost of scaling back Medicaid. Individual stories of those who rely on Medicaid bring the potential impact of cuts into sharp focus.
Imagine me, a single mother working 2 part-time jobs to support my 3 young children. My youngest, 7-year-old Leo, was diagnosed with severe asthma. Medicaid covers Leo's doctor visits, inhalers, and nebulizer treatments.
Consider also the story of Mr. Henderson, an 82-year-old widower who suffered a debilitating stroke. He requires round-the-clock care in a nursing facility. Medicaid covers the majority of his nursing home expenses. Then there is Sarah, a 24-year-old woman expecting her first child. Medicaid provides her with essential prenatal care. Stories like these illustrate the human fabric that Medicaid supports. When we talk about cutting Medicaid, we are talking about jeopardizing care for people like Maria, Leo, Mr. Henderson, and Sarah. The personal toll of such cuts would be immense. The potential consequences of scaling back Medicaid extend far beyond individuals losing coverage. According to analyses, significant cuts could result in as many as 15 million people losing their health coverage. This would place immense strain on emergency rooms and lead to poorer health outcomes. Work requirements for Medicaid eligibility could exacerbate this crisis. Many Medicaid recipients who can work are already working in low-wage jobs without insurance. The financial repercussions for healthcare providers would be severe, leading to a surge in uncompensated care. This financial strain poses a particular risk to rural hospitals, potentially creating healthcare deserts. When discussions arise about scaling back Medicaid, the primary justification often revolves around budgetary concerns. However, this narrow focus overlooks the broader long-term economic consequences and profound human costs. States that have not expanded Medicaid tend to exhibit higher rates of medical bankruptcies. Cutting the program would likely lead to an increase in personal bankruptcies. Another critical issue is churn, where eligible individuals frequently lose and regain Medicaid coverage.
This cycling in and out of coverage can lead to interruptions in care and worsening health outcomes.
The administrative complexity designed to save money can paradoxically lead to sicker populations and higher emergency care costs.
Broader trends in healthcare funding suggest a pattern where public health initiatives can be deprioritized.
Proposals that delay access to medication assistance for dual eligibles would inflict profound hardship. Standing up for Medicaid is a defense of human dignity and a recognition of our shared responsibility. The data consistently shows that Medicaid works. It saves lives and improves health outcomes. The moral imperative to protect and strengthen Medicaid has never been more urgent. Protecting Medicaid is about upholding a commitment to the well-being of our most vulnerable citizens. States that have embraced Medicaid expansion have witnessed tangible benefits, including a reduction in mortality and improvements in maternal care. The evidence is clear. Medicaid is a fundamental pillar of public health and a moral imperative. The future of Medicaid will be shaped by the actions we take today. Contact your representatives and let them know you support a strong Medicaid program.
Sharing personal stories can be a powerful tool for advocacy.
Raise awareness within your community about Medicaid's reach and the consequences of potential cuts. Encourage others to get informed and involved.
Pay attention to where candidates stand on healthcare issues when you vote. Support organizations that advocate for healthcare access.
Together, we can ensure that Medicaid remains a strong and reliable source of health and hope for millions of Americans.